All right. So today what we want to do is we want to get an introduction into doing a back massage. As a goal, I would like you to be able to do a back massage on your friends and family once you're learning some of the things that I'm going to give you here, which is some of the basics. Most importantly, once you've gone through this, is practice. So I can give you a few pointers, I can give you a few ideas, but then you got to practice it on people. So when we first get a person in, we're gonna, we work in the back, so we're gonna have them lay down. With Rob here, I have him have his clothing on, his pants are on, but the belt's loosened up, so I can go underneath and I can work the glute area a little bit if I need to. When I have him laying down, I just kind of want to observe his motion, or actually his breathing right now. I'll observe his musculature a little bit. I always tuck the sheet in to not get lotion or oil onto the clothing if they have clothing on. When I observe him here, I see some muscles coming up here. The shoulder blade is going to be right out here. Right here is the angle. Goes from right to here. That's the outline of that. When I go further down, I see the two muscles on the side of the spine. In here, right in the middle, is the spine itself, which the pointy pieces are part of the spine that go project backwards. That's bone, so we never want to cross bone. Pressure directly on bone hurts. When I go over across like that, it's not going to feel good. So I want to stay on the side of it. So it's important to know that landmark. But these muscles here, they love being worked on the outside, right here. Then when I come down, I feel a bony prominence that goes around, and that's we call that the iliac crest, which is part of the pelvis, the top portion of the pelvis. So the musculature above here is the back musculature, and the back below down in here, we have the butt musculature. So it's a little bit different when you get to the specific muscles in there. What I always do is try to take as much pressure off of the system as possible. So if you have a view and you're looking right in this area here, right now, it looks alright, it's not too tense. But when we lift up the legs, it's hard to see, but it relaxes it a little bit more. You feel that, Rob?
Yeah.
Good. So putting something under the knees, I got a roll, doesn't need to be a roll, it can be a regular pillow. That's fine. The other thing it does, it takes the pressure off of the feet directly, and they're not just flattened out, which can put a little extra pressure on it. And it is a pressure that is in the direction of somebody twisting their ankle, which a lot of people have, and that can be a little bit tender. And we do not want to encourage that motion. So then the next step is we're going to apply some lotion. How are we going to do that? Well, first of all, I use lotion rather than oil. The body absorbs lotion a little bit, I can work with it. With oil, it sort of stays on the surface. I just don't feel like I get the same connection as the tissue. But that's a personal preference. Oil is just fine.